There are 178 million people covered by health insurance in the US, and there are only 37 million health savings accounts. Of those 37 million HSAs, only 3.2 million, or 9% of them, are supercharging this account the way I'm going to show you in this video. It's what's going to take this $2,000 medical expense I had a couple of months ago and turn it into $13,000 of profit. In this video, I'm going to break down everything you need to know about a health savings account, why everyone should at least consider getting one, how to supercharge it like myself and 9% of accounts, plus show you how much I have inside of mine. Heads up right off the rip, I'm going to have multiple warnings throughout this video trying to talk you out of an HSA because they don't make sense for everyone, and some rules you have to follow so you don't screw everything up. At a high level, an HSA is a savings account that's attached to a health insurance plan where you can contribute pre-tax dollars, then pay for medical expenses with those pre-tax dollars out of the account. If you were like me when I first came across an HSA, this might sound extremely unappealing. Why in the world would you want to contribute to a savings account where you're restricted to only spend the money on health-related expenses? Well, because there's more to an HSA than what you see on the surface, like the fact that there are ways to get around having to use money on medical expenses, but we will talk about that as well as a ton of other things throughout this video. I need to stop to clear up a common point of confusion before we move forward. An FSA and an HSA are not the same thing. Let me repeat myself and be very direct so it sinks in. An FSA and an HSA are completely different. With an FSA, you have to use most or all of the money in the account within a limited amount of time. It's essentially a use it or lose it account. With an HSA, these restrictions do not exist. If you do not use money within your HSA, then it will continue rolling over and over and over every year until it's spent. I've gotten so many messages from people thinking that an HSA has the same rules as an FSA, but they don't. And to be honest, taking the time to correct all of these people even caused me to miss my girlfriend's work Christmas party. And I have been sleeping on the couch ever since then. So please, stop mixing them up. To gain access to an HSA, you must be enrolled in a high-deductible health plan. If you cannot meet this first requirement, you cannot contribute to an HSA. Later in the video, I'll show you how to make sure you are enrolling in an HDHP, but just know that this is the first rule you have to follow and there is no way around it. The amount you are able to contribute will increase at different rates every year, but starting in 2025, you can contribute up to $4,300 for self-coverage and $8,550 for family coverage. If you are 55 or older, you can contribute an additional $1,000 as a catch-up contribution. Two things I need to point out about contribution limits. First, notice how I said up to those amounts. An HSA isn't an all or nothing type account, so if you can only afford to contribute, say, $3,000 as opposed to the maximum, then that's okay. As long as you have money in the account, you'll still be able to supercharge the HSA like I'm going to show you in just a minute. Second, if you get health insurance through your employer, then sometimes your employer will offer the benefit of contributing some money into your HSA on your behalf. For example, one of my previous employers contributed something like $800 to my HSA when I completed a free health assessment with my doctor within a certain period of time. If your employer offers this sort of thing, then the amount that you can contribute out of your pocket for the year will be reduced by that amount. So in this example, you can only contribute up to $3,500 for the year, since your employer is hooking you up with an $800 contribution bonus. We've got a lot more to go through, but before I get into those topics, I want to show you how to supercharge your HSA like I and 9% of account holders are doing. There are two parts to supercharging your HSA: how you think about the account and how you interact with the account. So let's talk about how to think about the account, then I'll show you how to interact with the account. According to the latest data, 91% of people think about and treat an HSA like a savings account for medical expenses as they come up in the short term. Money is deposited into the account, then when they have to go to the doctor, to the dentist, pay for medications, or buy band-aids, they pay for it with money in their HSA. For the record, this is a perfectly fine way to use an HSA. You still get a ton of benefits from going this route. If it's working for you, then by all means continue doing it. But if you want to supercharge the account, instead of treating it like a health savings account, I want you to treat it as a health investment account or a health retirement account, such as a Roth IRA, 401k, 403b, 457, or pension, but better because of the tax savings, which we will cover in just a few minutes. I like to think of my HSA in two different ways. First, as a personal insurance policy where I get to keep 100% of the money within the account. And second, as a way to pre-save for medical expenses we're all going to have leading up to and during retirement. Us young people like to think that we are invincible, but as someone who has retired parents with health issues, the healthcare system will drain your retirement accounts faster than I can eat a 5-pound bag of gummy bears. Fidelity found that the average American estimated they'd spend about $75,000 on medical expenses in retirement. But based on their research, the average American should expect to pay $165,000. Think of it like this: to pay for medical expenses in retirement, we're going to need money from one of our retirement accounts. Instead of pulling those funds from something like an IRA, 401k, or 403b, we can instead pull them from an HSA, which is earmarked and optimized specifically for medical-related expenses. Then all of the other expenses you have can be paid for with those other retirement accounts. Please help support my little dog Molly as well as this channel by hitting that like button. Now that you understand how to think about a supercharged HSA, here's how you interact with the account to make it all work. Once money gets deposited into the account, there are 3 things you can do with this new pile of money. First, as I mentioned a minute ago, you can spend it on regular medical expenses, either by using your HSA debit card or reimbursing yourself for medical expenses you paid for out of pocket in the near term. Once again, there is nothing wrong with doing this. Second, you can let money pile up within the account and earn interest on it. The interest rates are comparable to the big banks, so we're talking really trashy, less than 1% interest rates. Your money essentially gets eaten away by inflation. Or third, you can supercharge the account by either choosing to invest some or all of the money. As you have medical expenses pop up during your working years, you'll pay for them out of pocket and not reimburse yourself from your HSA by withdrawing money or using your HSA debit card. That way, the money can continue to stay invested and grow into a larger amount. Here's my real life example so you can understand the math. Earlier, I mentioned the $2,000 medical bill I had for tendinitis a month or 2 ago. Since I paid $2,000 out of pocket to leave $2,000 invested, then 30 years from now at a 7% average annual return, that will grow to a little over $15,000 in my HSA. Put another way, by allowing $2,000 to stay invested, I actually gave my future self the ability to pay for an additional $13,000 of medical expenses in retirement. Yes, I needed to give up having $2,000 extra in my pocket today, but if it allows me to more than 6x my money and gain the tax benefits that we're going to talk about in just a minute, then I will do that deal all day long. If we take this idea and apply it to a single person maxing out their HSA with $358 per month and investing it for 30 years, then at a 7% average annual return, the account would be worth about $405,000. If you've got family coverage, then you can double these dollar amounts. Now here's the thing, to be able to reimburse myself for that original $2,000 out-of-pocket expense in 30 years, I need to be able to show physical proof that I spent that much on legit medical expenses back in 2024. This will need to be done by having a copy of the receipt or receipts from the doctor's office. Now we will cover that in more detail later in the video, and I will show you my personal foolproof system for how I do this. I've been saying for years that I like an HSA better than any other retirement or investment account out there, and that is due to the triple tax savings that it offers. First, unlike a Roth IRA, Roth 401k, or taxable brokerage account, you do not pay federal, state, or payroll taxes on money put into an HSA. Quick warning for the people who live in California and in New Jersey. Your states do not recognize the federal tax advantage of an HSA. Because of that, they will still make you pay state taxes on this money because, I don't know, they must not like you and want to help you out. Second, you do not pay taxes as your money grows if it's invested. And third, unlike a traditional IRA or 401k, you will not pay taxes when you withdraw money from the account as long as it's for approved medical expenses. Don't worry, later in the video I will show you how to get around this rule of withdrawing for non-medical expenses, so just hang tight. To state the obvious, there is no other account that offers this type of tax savings. It's very unheard of for the government to allow us to skip out on paying taxes once, twice, let alone 3 times. As I mentioned before, you must be enrolled in a high-deductible health plan to be able to contribute to an HSA. There is no way around this rule. I'm going to state something else that's very obvious here. High-deductible health plans do not make sense for everyone. You're going to need to weigh the options based on your specific situation. But on the other hand, don't just look at the word high deductible and assume that it's automatically bad, because this just is not true. Yes, there will always be unpredictable health events that happen to all of us, which is what emergency funds are there to help pay for. But let's not pretend there aren't ways to reduce your odds of spending money on health-related expenses by actively working on things that are in your control. Losing some weight, eating more whole foods and less processed foods, working out, getting better sleep, managing your stress levels, and not partaking in stupid, high-risk activities for literally no reason. If you get health insurance through your employer, then they should list which plans are a high-deductible health plan like you see here from one of my previous employers. They should also call out whether it's an HSA-approved plan, but if not, then double-check with your HR or benefits department just to be safe. If you are not sure, please don't blindly assume. Take the couple of minutes out of your day to send an email to the correct people. If you get health insurance on your own through the healthcare.gov website, then you can easily filter on HSA eligible plans to get your list of options. Once enrolled in an HDHP, next you need to open a health savings account with an HSA provider so you have a place to contribute money. This can go one of two ways, depending on if you get health insurance through your employer or on the open market. The HSA provider is a separate third-party company that houses your actual account. It's where money will be deposited, withdrawn from, and where you can invest your money. While your employer may interact with this account to deposit money on your behalf from each paycheck, you have full control over this account. They cannot pull money out or do anything other than deposit money. When you leave your employer, this money will stay right where it's at. It won't go anywhere unless you move it to a different provider, which we will cover in just a minute. I'll also tell you which ones that I think are complete trash and which one is good. If you get health insurance through your employer, then they've most likely already chosen who the HSA provider will be. Once you find out who it is, your employer will give you directions on how to open the account so it links properly to their payroll systems. At that point, your employer will auto-deposit pre-tax dollars into this account when you get paid. Once you leave your current employer, if you don't like the HSA provider they forced you to use, you can roll that money into a different one. You cannot change providers while your employer is actively depositing money into the HSA with the provider that they chose. You can, on the other hand, do a partial balance transfer, but not a full balance transfer. If you get health insurance on your own through the open market, then you need to open an HSA with any provider that you want. Now, unlike the people whose employers deposit money into the account from each paycheck, you need to manually deposit money into your HSA. One thing to mention about this self-directed HSA is that you'll be contributing to your HSA with dollars that have already been taxed, so you don't see the immediate tax benefit. When you go to file your taxes for that year, you should receive a form from your HSA provider to let the IRS know that you contributed X amount of dollars for that year into your HSA. This will lower your adjusted gross income by that contribution amount so you get the federal tax savings. The only disadvantage of having to go the self-directed route is that you won't get the tax adjustment for your FICA taxes like you would if an employer is depositing money into the account on your behalf. This isn't the most ideal situation, but regardless, the rest of the tax benefits from an HSA still make this account a great place to put your money. Now, when it comes to HSA providers, I have very opinionated thoughts, which is why I refused to let any of them sponsor this video, even though I could have made a lot of money. Lively, Health Equity, HSA Bank, Optum, literally all of them are complete trash for various reasons. The only one I recommend, even though I'm not affiliated with them, if you have a choice, is the self-directed Fidelity HSA. I do not recommend the Fidelity HSA Go because of the advisory fees that they charge. The reason I don't like any other HSA providers is because they all force you to hold a minimum amount of cash in your account. So for people who want to maximize their account by investing all of the money, being forced to hold $1,000, $2,000, or $3,000 in cash is extremely annoying. Fidelity has a $0 minimum cash balance. All of them except Fidelity also charge a wide range of account fees. They can range from a dollar amount to a percentage of your balance. Sometimes your employer has worked out a deal to get these fees waived. But if you no longer work there, or you are a self-directed HSA person, then they will charge you. These fees are separate from the fees that you pay to invest in certain funds, which you should expect to pay and are perfectly fine as long as they are low-cost options. If your employer forces you to use one of these trash HSA providers, there's nothing you can do about it except suck it up. Then when you leave the company, make sure to roll the whole balance into a Fidelity HSA. For future reference, when you roll the money from another provider to Fidelity, you'll create a Fidelity HSA account, then initiate the transfer process from the Fidelity side of things. Then, Fidelity will handle reaching out to the other provider to get your money completely rolled over, and you shouldn't have to do anything other than that. At this point, you should have a good handle on getting money into an HSA and what to do with it. So let's talk about getting money out of the account either in the short term or in retirement if you're supercharging it. The only people you can withdraw money for is the account beneficiary, spouse, or dependents. If you withdraw money for anyone other than these people and get caught, then you're going to pay a penalty. Look, I get that some of you want to help out friends or non-dependent family members with their bills by using your HSA money, but please do not do this. According to the IRS, any part of a distribution not used to pay qualified medical expenses for the beneficiary, spouse, or dependent is includable in gross income and is subject to an additional 20% tax. Like my grandpa always said, play stupid games, win stupid prizes. I promise you, this is not a stupid game that you want to play because the IRS will catch you. There is an insane number of approved medical expenses that HSA money can be used for, which you can see on screen right now. Plus, more items get added to the list every single year. But there are also subcategories of approved medical expenses that aren't specifically called out on this list, like contact solution. If you ever want to double check to see if something is HSA approved, then there are a few things you could do. First, go to Google and type in what it is and if it's HSA approved. For example, I'm currently injecting myself with peptides to heal my tendinitis a lot faster, but I want to know if it's HSA approved. So in this case, I would go to Google and say, is BPC 157 HSA approved? Or is TB 500 HSA approved? Or are peptides HSA approved? Unfortunately, they're not, so I can't reimburse myself for buying them. But Google did give me an accurate answer very quickly. You can also go to websites like hsastore.com or the HSA side of Amazon to search for certain products to confirm if it's HSA approved. If it is, then you can either buy from one of those websites or shop for the product in a physical store if you want. For people who spend HSA money as expenses come up in the short term, you're going to want to save a copy of your receipt to show proof that what you spent the money on is in fact approved. The general rule of thumb is to keep records on hand 3 years after the tax year that you reimbursed yourself, just in case the IRS audits you. For people who are supercharging the account by paying out of pocket today with the intention of reimbursing yourself many years down the line or in retirement so your money can stay invested, you're also going to need to do this as well. But it can be a little trickier since the odds of you actually keeping physical receipts for 20 or 30 years is pretty darn low. Throw them in a random drawer or move a couple of times, and I'll bet money that you lose most, if not all of those stinking things. Unfortunately, the IRS won't buy the whole "my dog ate my homework." Think of these things like Willy Wonka's golden tickets because they are as valuable as money. If in 30 years you withdraw $2,000 from your HSA for an expense that you had 30 years ago, and the IRS audits you looking for proof of that expense that you don't have, then you are going to have that amount added to your gross income and pay that 20% penalty. This is why I created a digital system to handle everything, because there is no freaking way that I'm messing with physical copies of anything. Here's my process that you can adopt if you want. First, create 2 folders on a cloud-based storage platform like Google Drive. Name the first to be paid out and the second paid out. Every time you pay for something out of pocket, you'll either take a picture of it or use an app to scan a copy, then place it in the to be paid out folder. Rename the file with the dollar amount first, followed by the date listed on the receipt. The thought process behind this is that in 30 years, you're most likely going to want to withdraw a particular amount. This will make it easier to filter from lowest to highest to batch a couple of receipts together that total up to the amount that you want. Then once you, for lack of a better term, cash in on those receipts, you move them to the paid out folder so you don't accidentally try to withdraw the same expense twice. You don't have to do this, but I also track each expense in a spreadsheet so I can have a high-level view of what I'm working with. I always get questions about if the IRS is really going to allow you to wait to reimburse yourself for 10, 20, or 30 years. These are extremely long periods of time, so I understand why most people would be skeptical. As you can see on screen, the IRS has answered this question directly, so there is no confusion. But what if you are someone who has built up a big enough HSA to where you honestly don't think that you're ever going to be able to spend the full balance on medical expenses? Well, the good news is that at age 65, you can start withdrawing money from your HSA for non-medical expenses without paying that 20% penalty. The only catch is that the amount that you withdraw will be taxed as ordinary income, which means that the account basically turns into a retirement account such as a pre-tax IRA or 401k. But the big difference is that with a traditional IRA and traditional 401k, you're forced to take required minimum distributions starting at age 73. With an HSA, you don't ever have to pay RMDs. So let's say you're someone who has grown your account to something like $270,000 by 65. You can look at your current state of health to determine if it makes sense to keep all of that money in the account for future medical expenses, or maybe say withdraw $100,000 for non-medical expenses, pay the tax, then leave the remaining $170,000 for medical expenses. At the very least, having built up a nice HSA balance over the years is just going to give you a lot more financial options in retirement. I personally got my first HSA and started investing in it in 2019. Since then, I've maxed out the account from 2019 through 2023. Not in 2024 because, to be honest with you, I rolled the dice and did not get health insurance, so I could not contribute to an HSA. Shh. Please don't tell my mom. But from 2019 through 2023, I contributed a total of $18,150, and my account is worth a little over $25,300 today, with an average annual return of a little over 11%. I'm planning to get back on an HDHP in 2025 and start maxing out my HSA again. But for fun, let's just say that I switch back to health insurance where I cannot contribute to an HSA. If I don't add any more money and leave that $25,000 invested for 30 years at a 7% average annual return, then the account would grow to about $192,000. That's what's nice about this whole thing. We have to renew health insurance every year. So if you come to a point in your life where an HDHP doesn't make sense any longer, then you can always switch away from it and leave your HSA money invested to allow it to continue growing. If you want to know how I invest all of my HSA money, then you can learn more about a two-fund portfolio in this video to your left next. Hit that like button before you go. I'll see you in the next one, friends. Done.